Hello, my name is Mike Shoemaker, and I serve on the board of the South Carolina Asthma Alliance. I'm here with Dr. Carey Gully and Dr. Mike Bowman, and we're going to share with you today an innovative program that Dr. Gully has put into place in her office. This is in response to kind of a call to action to help get kids ready to go back to school, knowing that there are some problems late in the summer and heading into the school year. So we'll be discussing this program over the next 15 minutes or so.
I'm Mike Bowman. I am a pediatric pulmonologist at the Medical University of South Carolina, and I've been involved with the Asthma Alliance as well. One of the things that seems to be a major deficiency in the overall care of children with asthma is the fact that families are comfortable during the summer, youngsters are doing well, and they wind up slipping in terms of their medical care. They wind up then going back to school and getting sick almost immediately. It's been well known for several years that there is a major flare in asthma symptomatology, severity. In South Carolina, that accounts for a 40% increase in Medicaid expenditures for childhood asthma between June and July versus August and September. That accounts for $1.2 million a year or so in expenditures. At the Medical University of South Carolina, we generally have 5 to 7-fold more admissions for asthma in August and September versus June and July. So it is clearly a problem that relates to children going back to school, whether it is a virus that goes around almost immediately, as folks in Canada seem to think they relate it to rhinovirus infection. Others say it's being around a different environment in the school system. Once school starts, clearly youngsters get sick right away. So we've tried to figure out ways to deal with that, and we've tried to coach practices and families that they need to recognize that this is coming at the end of the summer. So last year, the last 2 years, we have sent out information to people around the state from the Asthma Alliance about this issue, trying to urge that youngsters see their doctor during the summer to be on the appropriate medications and under good care. We were thrilled to learn that Dr. Gully in her practice took this message to heart and came up with a truly innovative approach to utilize some of the off hours during the summer in their practice to do asthma-focused visits, and that's what we're here today to talk about. So, Dr. Gully, could you describe to us what your program involves?
Sure, I'd love to. I'm Carey Gully. I'm a private practitioner in rural Seneca, South Carolina. I own Blue Ridge Pediatrics, and I'm excited to be here. I first heard from Dr. Bowman back in March of last year. He had sent a letter out requesting that practices start trying to think of some sort of a program that would decrease the amount of asthma exacerbations upon return to school. And due to the nature of pediatrics, we are fairly slow in the summer, and I thought this would be a great program to start. Not only we'd have more time for education of the patients, but there's always room for improvement with asthma, and we had not done anything like this in the past. One of the main things in our practice is not really emergency room visits or hospital admissions with that. We do a pretty good job, but the kids were not prepared to go back to school. They were not always on optimal medication. They were not always sent with spacers, and certainly not their extra inhalers and prescription medication forms for school. And so we usually find out about those a month or two after they have their first problem, and then we get them all set up. So we decided we were going to meet the whole practice would meet as a group and come up with a plan for how we would set up a visit. And one of my nurses coined the program AIR, A-I-R, and it would stand for Asthma Intervention and Return to School program. And we came up with a visit plan and involved the entire staff from front office to nurses to myself, and then the 3 other nurse practitioner providers, and it became very successful.
Dr. Gully, do you think there's anything remarkable about what you had to start with? Is this something that almost any provider could put into practice in their own setting, or were there unique things that you either had in advance or you needed to get in order to make it work?
No, we did not need anything advanced, or we simply, what we did was each of my practitioners is well trained in asthma. So my first thought was we needed to develop a form for a visit that would incorporate the guidelines, and then also ensure that the patients were sent to school with everything they needed. So all I did was have a lunch scheduled for an hour, and we got the whole staff together, including front office staff, and we went ahead and discussed how the front office staff would get in all the patients, would they call them, and basically we decided in our practice that patients would be identified as they exit at a visit. If they were an asthmatic, they would be scheduled a follow-up form sometime in the months of June through August for an air appointment. And then, or we would call patients that we knew were asthmatics from our records, just calling them up in general. Or if people were due for physicals, we would schedule them for a physical and also the air appointment closer to school starting. And so the part of getting the patients in we knew would be feasible and easy to do. And our goal wasn't to get every patient in, but as many as we possibly could fit in our schedule. And I think we did about 300 visits over the summer, which was much better than we thought, and the response was excellent. But we'll get into that a little bit more later. The other thing we did was teach the nurses how to do asthma teaching. We don't have a certified asthma educator. In the future, I'd probably like to do that, but for our practice and what we needed right now, just education and making sure we were all on the same page as far as demonstration of spacer use, proper medication use, stressing compliance. All the nurses were able to do that and teach it very well, which made my job a little bit easier after the visit. And then as far as, so the program was set up that the patient would be set up for an appointment. The forms were made such that the parent, or if it was an adolescent or older teen, would fill out a questionnaire at the top of the form, asking them what their medications were, if they had any exacerbations or what symptoms, requesting about symptoms that nighttime cough, cough after exercise, how often they were using their inhalers, their rescue inhalers, and then the nurse would do the intake, which is vitals, O2 sats we did, standard, and then I would go in for the visit, which took about 10 to 15 minutes at the most, and then after I would do some level of education, but after every time I went in, I would send the nurse back in to go in and do some at least brief asthma teaching to make sure they knew how to use their spacers and that they had their forms for school, their spacers, one for home and one for school, and then also the permission forms for school. So they were all sent home with that, a checklist in an asthma plan.
Did they also have a medication inhaler for school for their rescue medicine?
Yes.
Along with the spacer?
Yes, correct, of course. Yes, they needed, that was on the form too as a checklist. So they had their spacer and their rescue inhaler, one for home and one for school, and then also their action plan too. Mm-hmm.
Good. Were the patients all follow-up patients, or did you have some new patients in this group as well?
Well, we did. So if we identified, we always have new patients. So if we identified a new patient or a new asthma patient, we would schedule them for follow-up as a separate visit for an air appointment. So the air appointment was always done separately in order to increase the amount of time and education so that we could get them ready.
How did the families like it?
Well, the families were extremely supportive. There was a little bit of concern if they would be frustrated with the fact that we would call them back in for another appointment, but in actuality they were very appreciative of the amount of education. They felt confident that the kids were ready for school. They really liked the fact that were proactive in giving them this extra spacer and making sure all their medicines were called in. That the moms did not and fathers did not have to worry about calling in for refills, or the children running out of their medication. So they felt like we do really care about their children, and they were very pleased that we took the initiative to make sure they're taken care of when they go back to school. And as a result, we did see great improvement. We also got really great feedback from the schools. The school nurses were very appreciative, and that was probably one of the nicest things for me, is that they didn't feel helpless when a child comes to them, and then the parents weren't having to get called from home, and children weren't getting sent home and missed days because maybe the nurse didn't even know they had asthma, or the child just didn't have their medication. So majority of the times the kids were treated in the school and returned to class, and no one was affected. So that was really nice too.
That's the goal, very much. That's outstanding. Do you have any insight or idea about how things changed this past year versus years in the past for kids needing to go to the emergency room or being admitted or anything like that?
Yeah, our practice is a rural health clinic, and we're kind of unique in that we are a small practice, and so we have very few hospital admissions or ER visits. I do tell the patients that I really want them to call me if they feel like they're going to the emergency room, because I can usually talk them through to the morning. But we did show some improvement on the emergency room visits. The year prior, in September and October, we had approximately 4 to 5 ER visits, no hospitalizations. And then the following year we had none, so it wasn't a great improvement, but it was some improvement. But the vast majority of the improvement was in the amount of kids, I think, that got sent home from school because they had an asthma exacerbation and weren't prepared. And then also the control of the asthma going into school, because like you said, most children and their parents, they have a smooth, late spring and summer. They haven't had any problems. They run out of their kids' medications for whatever reason, or they miss a follow-up. And then they go back to school. Everyone gets sick in August and September, and then all our kids with asthma don't have their medicines. And so we absolutely, without a doubt, saw a huge improvement in compliance, parents' confidence in the ability to treat their kids, the school nurses' confidence and ability to treat the children, and the children's confidence in the ability to prevent themselves from getting sick. And that was probably the greatest achievement. And there's no doubt that we saw improvement, and it was a relatively easy thing to implement, and also beneficial to the practice and the patients as well. So
it sounds like you hit every piece of a successful program right on the head the first time, but I'm just curious, if you do this again next year, is there anything that you would do differently than what you did this year? Yeah,
I asked my nurses about this, and there were a couple of things I think we would like to identify the patients, but the children with more like moderate to severe persistent asthma, and then the children that we have problems with compliance for whatever reason, bouncing back and forth from homes, or inability of caretakers to get the medications. We'd like to separate those out and probably see them early in the summer for a regular visit, and then see them closer to school starting for the visits, so that they have all their medications right when they go to school. Our less complicated patients, and we can give them their medications and forms in June, and feel fairly certain they'll still have it then. But we're also going to save all of a copy of all of the authorization forms for school, so that we can fax them in case they lose them. So the nurses have already done that. And then the other thing we wanted to do was to make sure all the patients bring their medications and spacers to the visit, which we tried last year, but we didn't actually really reiterate that when we made the appointment. So a lot of times we can't really demonstrate, because we don't want to, if they've got 2 spacers, we don't want to use another one. So we're trying this year, we started the program again, we're trying to make sure all the kids bring all their medications and their spacers to every visit. So we'll see how this goes. We've had 3 patients so far, and 2 of them brought them.
It's fantastic.
I think it's amazing, out of 300 patients, to have no ER visits or hospitalizations.
It is amazing. I'm very proud of our staff.
I mean, you can't get any better than 0.
No,
that's just amazing.
And most of it, I feel bad taking credit. Most of it has been, I have a wonderful staff that was we truly want to improve the care, and they really I always bring them these new things to do, and they always have a good attitude about it, and they really implemented it well. And the kids have, and it's shown through their hard work that we've made a big difference. So,
did you have any vaccine updates or catch-ups in any of these visits?
Yes, we're pretty good about immunizations, but certainly if we had a patient come in at any visit that we see they're not up to date, we do catch them up if possible at that visit. And then flu vaccines, the summertime visit was a great time to go ahead and remind them about the October, coming in and making an appointment in October. And this year we were kind of toying around with possibly just going ahead and setting up an appointment once we figure out how we're going to do our clinics. So we may actually set up the patient with an appointment so that we'll remember to call them in mid-October or early October to get them in for their flu shots. But yes.
That's great. Can people reach you if they have questions or want some more information? How might they go about contacting you?
Yes, I welcome anyone that had any questions. We have a website. It's blueridgekids.com. And on the website, if you look under parent education and forms, there's an visit page, and it has all of our forms. It has our 2 intake forms, one for adolescents and one for younger children for their parents to fill out. And it also includes the documentation of the visit and how we kind of coded it and did it. And then also has our asthma education form, which also kind of serves as our action plan form that we used. And anyone's welcome to use it or duplicate it. We'd love to see practices take off with this.
That's great.
Yeah.
So Dr. Gully, I think you've covered just about everything in your program. It sounds like a fantastic program. We thank you so much for sharing that. Thank you for heeding that call to action and getting kids in and making sure that they're ready for school. And I'm sure that you'll be getting some contacts through your website and your phone and email.
Yep. They're welcome to contact me.
Thank you very much.
Thank you for having me.
Thank you so much for doing it and talking about it. We really appreciate that.
You're welcome. Appreciate it.